Hello, my name is Dr Miro Griffiths. I'm a research fellow in disability studies and social policy at the University of Leeds. I am a disabled person. I have a neuromuscular condition that affects my muscle strength from the neck down. This means that I use a wheelchair on a permanent basis. It also means that I require intensive medical treatments and interventions on a daily basis, ranging from physiotherapy to medications and treatments to improve my lung function. It also means that I require 24-hour personal assistance, and I am supported on a daily basis with all tasks, ranging from personal care all the way through to supporting me to participate in my communities and in my places of work. I'm fundamentally against the assisted dying bill. This is a very dangerous time to be a disabled person in society. We are coming out of a pandemic where disabled people have been placed in very precarious situations, denied access to healthcare. They've had their value as human beings judged and questioned on the basis of emergency healthcare treatment. And we've also seen situations where disabled people have been denied access to local service provision and support. Also, if we look at it more broadly speaking, disabled people have historically and in contemporary society faced extensive marginalisation throughout the life course, from childhood through to accessing education, the labour market, participating in your communities. Disabled people are often denied opportunities due to poor access of support and policy provision, due to people's attitudes, and due to the environment and the way that we build and construct our communities. So disabled people are marginalised, and this creates situations where disabled people start to question their self-worth, their value to society, and they start to internalise their feelings of not being good enough to survive, not being good enough to live a life in society. And this is created not because of their health conditions or illnesses or impairments, but it's due to the way society is organised. And this takes us to think about the assisted dying bill. The purpose of legislation and policy should be to protect people's lives, and it should be to increase opportunities for people to participate and be valued in their communities. And the assisted dying bill does none of these things. The assisted dying bill provides an opportunity for people to have their death facilitated by the state and by medical professionals. This is a very dangerous situation. The bill is incoherent. The supposed safeguards that are provided are inadequate, and they are messy and complicated. For example, how does an individual with 6 months left in their life access the judicial system and have their application verified and approved by the judicial service? How do they access healthcare provision at a time when healthcare is under much strain and provision to services are not allocated enough resources? How does an individual have their settled status and their settled mind verified by professionals who are not equipped to understand and determine whether an individual is of clear and sound mind? This creates very dangerous precedents for providing support to disabled people, and it also means that healthcare provision will be geared towards facilitating an individual's death rather than supporting them to live the best life they can as their health naturally progresses into different stages and possibly towards the end of life. Surely the emphasis should be placed on providing better support for people to live the life that they want for as long as they can in communities and in society that respects and values their contributions. And when you look at the data in other countries that have passed assisted dying and assisted suicide legislation, you see creeping effects of criteria expanding to more and more people can access such forms of assisted suicide. You see increased numbers of people accessing the system. You see healthcare professionals becoming concentrated around only a few individuals who will provide the prescriptions and the necessary treatments to facilitate the death. This is very dangerous, and I don't know why we are focusing on dignity in death when disabled people don't have dignity in life. So I encourage everybody to consider focusing more attention, more resources, and policy and legislation orientated towards supporting disabled people to be valued and live the life that they want in society, rather than accelerate people towards their death.